good luck to you. Now, I was going through social media as you do, and I saw a tweet, and it actually gave me a lot of hope, and not just me. It was amazing. Nurse Nikki Rushin has actually posted this message. Let me read it out to you. What my last shifts working with COVID-19 patients has shown me is that if you follow strict PPE guidelines, that's for the personal protection equipment, of course, work calmly and precisely, it's not as scary as you think it's going to be. Media hysteria raises anxieties, but as nurses, we are used to working under pressure. And then it ends with, we've got this. Well, I'm very glad to say that Nikki joins me now on the phone from her home in Nottinghamshire. You've had an amazing response to this, Nikki. What made it so important for you to put that message out there?
I know. Hello. Thanks for having me, Lorraine. I work in mental health, and I've worked in A&E, and my job, I've always wanted to care for people, look after people, raise people up, raise spirits. That's just me. And so with my Twitter, I use it as to do with my work and with my university. And I literally wanted to give people hope, because before I went on shift, I was really nervous. I was having wobbles. I wasn't too sure what to expect. But when I actually went on shift and I worked with COVID-19 confirmed patients and query COVID-19 patients, I really, really found that my training come into play. What I'd learned over the years really, really made a difference. And so I came home from 2 night shifts, and I just reflected on what had happened on those shifts, and I was a lot calmer and I was a lot happier. My family were anxious, and once I'd explained to them that if you do it precisely with the correct PPE, and I know some places haven't got the correct PPE, but for my trust we do, luckily. I just wanted to give people reassurance, help people be calm, because everything on the TV, everything on the news is so depressing, and it's all about people dying, but there are people recovering, and we need to focus on the good stuff. It's not all doom and gloom, and I know it is, and I'm not putting anything down for anyone who's lost any relatives. It's heartbreaking, but there is positivity out there. And for myself, as a mental health nursing associate, I'm worrying about people's mental health now while they're isolated, and also after this. People are going to be worrying, they're stressed, they're losing jobs. Staff coming into the hospitals, they're scared. They don't want to bring anything home to their families. And it's not just the nurses or the HCAs or the doctors. You've got to think it's the coders, it's the admin staff, it's the cleaners, it's the porters. Everyone is going in and everyone's scared. But when you work at a hospital, for myself, I definitely know that you're a team, you stick together, you calm each other, and we are human, we do wobble, but we hold it together while we're looking after the patients.
It's like what you said, we've got this. And it was just that at the end of your tweet, just really heartened me, because you're right, there is a lot, and you look, it's a very, very, very serious situation.
Yes.
But for people like you, right at the sharp end, you're at the coalface, and you're having to go home and almost self-isolate yourself, because you're worried about your own family, aren't you? How does that work, Nikki, when you go back to the house?
My parents live with me as well. They live attached to our house, and my mum has COPD and my dad has dementia, so obviously they're really at risk, so they are isolated from us. Myself, when I come home, my 2 daughters and my husband, I have been living in 1 bedroom and 1 bathroom, and coming straight in from work, going upstairs, not even touching the dogs, because just in case the kids touch the dogs after, and then going straight back out to work. I don't want to bring it home. Oh my God, I really, really don't. But I can't not go to work. I have to help people. And I work in mental health services, and we have patients with COVID-19 who are mentally unwell. So they're dealing with that, and they don't quite understand sometimes, and it must be so scary. So if I can go and support them, if I can just go and make them smile, anything, just people need our help. They really, really do.
They really do, and thank God for you that you're actually doing that. You know, you're making all of these sacrifices, you know, going into that situation. It is quite remarkable. You talked about mental health, and it is something that I think when finally this is all over, that sadly will be something that we will have to deal with. I mean, you must be concerned about that because we need to make sure that we have the facilities and the funding to help people.
Very much so. Before the COVID-19 really kicked off, we had people like the Duke and Duchess of Cambridge, and they were bringing mental health for children to the forefront. Then you have celebrities bringing mental health to the forefront, and you have men like Jason Fox from the SAS show. He talks about his mental health, and it's very important to talk. And I think when people realise, especially men, because I deal with male mental health, that it is okay to talk. And if you've got someone as rough and tough as an SAS man and they can struggle, then we all can. So I think it's important that everyone talks now. Communities are getting back together again a lot more. Neighbours are talking more. Friends, family are phoning more. We need to talk. We need to say, do you know what? I'm not feeling too good. I'm scared. I'm not handling this. I'm not dealing with this. It is okay to talk, and we have to talk. Male, female, doesn't matter. Everyone needs to talk.
You're
because
so right.
all the job losses, everything that's happening out there, people... I mean, the suicide rates are huge. They really, really are. And that is a real big issue. So now we need to be talking. We need to be getting online, talking to people, even simple things like looking at memes, looking at positivity memes on the internet, anything that will help you get through this.
No, that makes perfect sense, Nikki. You're absolutely remarkable. All the things you're saying, it's just like, you know, that's really what we're trying to do as well, because I think that is important. You know, we will obviously be bringing you the news, of course we will, but we're trying to shed a little bit of light sometimes, which is so important. Now, you said in your trust you do have equipment. Sadly, that's not happening all over the country. I wish it were. Have you been tested? Have you been tested at all? Is that going to be happening?
No, we won't. It'll be, as far as I'm aware, it's the A&E, the frontline staff, the ITU staff, the GP surgeries, the people who are initially coming in contact with patients. I know we are as well, but, you know, you're talking in ITU patients who are intubated. Those nurses, those doctors, those healthcare assistants, nursing associates, they need to be tested. We all do, because... If I started showing symptoms, which I did a few weeks ago, and I had to take 7 days off work, it never ended up becoming anything. But that's a waste of my time, and I could have been nursing my patients. So the quicker all healthcare workers, all NHS staff, that's including admin as well, if we can get tested, then we know we can go straight back to work. And we don't have to be off.
Nikki, Dr. Hillary here, and I couldn't agree more with you about the importance of testing, and I hope that's rolled out as quickly as is practically possible. I really hope that happens soon. What you're talking about is your professionalism, your dedication and your discipline is getting through. It comes through in your post, but you're using all of that at this moment more than probably ever before, but it reassures you and it's reassuring everybody who works around you. Let me just ask you, when we're talking about mental health, do you as a profession, as the nursing profession, get a chance to chat to one another, to allay anxieties and fears and to put everyone's mind at rest when you're working?
It's like any ward. It's like an acute ward. It's like a mental health ward, a learning disabilities ward. You know, we're all really, really busy. So we do get the odd 10... If it's really, really busy and you're struggling, for our patients as well, be quite chaotic at times and calm. It's keeping weary COVID patients away from each other when you have a mental health patient that doesn't really have capacity. So we've got that as well that we're dealing with. And all the staff in mental health are working really, really hard to try and keep the patients and themselves really safe.
Nikki, you're doing the most amazing job. It has been a joy to talk to you. It really has.
Everyone is. Every NHS person, police officers, everyone.
I know. It's been brilliant to talk to you. Let's catch up again. Great to see you, and thank you very much. Stay safe. Lots of love to your family. And thank you for everything that you're doing. What an amazing woman.
Amazing.
Just extraordinary. And
great example.
Trying to find some positivity, I think, is really important. She's quite right. Thank you, Nikki.